Analysts at the center say these numbers may add more support for health care reform. For an instant on this, Uri Mann is joining us for the first time this morning from Florida, where it's hopefully a bit warmer than it is up here.
It's warmer.
I always get a little nervous. Go ahead. It's warmer.
Unseasonably cold for Florida. We have 45 degrees today, but
you know what?
Still warmer than where you are.
Cry me a river. Anyways. Yeah, don't complain to us. That's Paul Vigna. He's the news editor at Dow Jones Newswire. I'm also going to bring in, guys, if we can get a camera on George Stahl. He's of Dow Jones Newswire. He specifically covers healthcare sector. So I want to know, George, you heard some of those reports that I just mentioned. I mean, these are some other reports that we've heard for the last couple of weeks. Does that add up to what you're hearing about where the state of the healthcare reform is right now?
Yeah, I think that it shows that there obviously is a problem, and this is why the government is addressing it. Now that, though, that the public option may be off the table, it's going to be interesting to see the effect that the reform bill has in actually producing the change that lowers the cost of health care.
And is it doing that? I mean, $7,700 per person was what this recent study showed us for 2008. So we know 2009 is probably higher than that. I mean, we could only assume that, but that's a lot of money.
Right. And I'm not sure that the reform bill as it's currently structured really gets at the heart of what needs to be changed in healthcare, which is the payment system and the way that people are billed.
How would that change? Can you tell, I mean, walk us through this. How would it need to change? If I have health insurance, I go to the doctor, I pay a copay, I might have to pay some extra if there's laboratory tests or whatever there is. It might be above and beyond what my insurance covers. How would the rights kind of reform, according to some of the things you're hearing, look for a patient?
Well, they need to open up the market of healthcare, make it more of a free market business so that there's price competition, and that would help to reduce the costs. A lot of what's being debated in the reform affects what's on the fringes of the healthcare and doesn't address what the companies are charging and how the market prices the devices that are used in healthcare, the drugs that are used, as well as the payment system to the doctors and the hospitals.
Because, Uri, it's hard to even kind of imagine what a different healthcare system might look like, because I think most of us are so used to being consumers in this current system. As someone that's watching the markets, you're a financial analyst, what are you watching just as these conferences are going to continue between the Republicans and the Democrats and the Senate and the House to bring a final bill together?
I agree with George's sentiments about this bill not necessarily addressing the heart of it. The problem is that even we won't really know what the effects of this health care bill are for some time. A lot of the policies that are within the bill don't take effect for years. I mean, you look at some of the biggest parts of the bill, for example, taking care of people with pre-existing conditions, that doesn't take effect till 2013. The actual tax credits for people in low income and middle income to help them with health care, they don't take effect until 2014. So it's questionable, and we won't see the results of these new policies for some time. In terms of looking at immediately at stocks, generally you could say, well, healthcare stocks should do better because they've underperformed in 2009. Now that the Armageddon scenario of a public option is pretty much gone, the idea that basically these insurance companies could lose all their customers to a public option, now that that's pretty much off the table, healthcare stocks should do pretty well. Hospital stocks should do well, as they're going to be able to deal with fewer people who are uninsured. Pharmaceutical companies should do well because they'll have a larger pool of people to service. So generally, I'm upbeat about the healthcare sector, even though it's not one that I follow as closely as George.
Okay, real quick, I'm going to have to run, Paul, but any quick thoughts? I mean, you watch the market tick every day.
I think George nailed it on the one hand. The payment system is a big issue, and this bill didn't get to it. It didn't address the fraud, the waste that exists within that, and that's an issue. On the other hand, is the sort of the larger scale of how we're going to pay for health care as a nation, and unfortunately they did kind of address it because it's taxes. You want to insure everybody, that's a public good. I'm not necessarily saying it's a bad thing, but you're going to pay for it in taxes. And a lot of these proposed taxes right now are on the high end, on the rich, on the wealthy. If that goes through, that's what will happen. But eventually, especially with Medicare, with this reform, that's going to be paid for by the public at large, and that's going to translate into taxes.
And that's going to come sooner rather than the service.
There's no two ways about that.
Yeah. All right, Paul, George.
No,
it's
interesting that.
Oh, Uri, go ahead.
Quick
final thought. You can.
No,
you were giving that to you only because you're not as cold as the rest of us.
Okay. Now, I was just going to say that it looks like if the Senate bill is the one that actually takes form and passes, the taxes on the Cadillac plans, you know, are going to be very significant. And it was interesting, you know, during the campaign, we saw Obama campaigning consistently about the fact that McCain was going to tax health care. And now the Obama administration is in favor of taxing health care. And if you look at those taxes, they really are a tax on the middle class. And 90% of those Cadillac plans are held by the middle class, not by the uppermost wealthy individuals in the United States.
Yeah, when you think Cadillac, it's a good point, or you think like, you know, Cadillac, the rich guys, but it's not just the rich. I can almost see the frost behind you, almost, but not quite. Anyways, Uri, thank you very much, and Paul and George as well. We want you to weigh in on what you think about this.